This podcast is for entertainment purposes only. The opinions expressed in this episode are not to be construed as medical advice.
Welcome to Demystify Beauty, a weekly podcast about creating transparency in the beauty space. I'm McKenzie Westmore.
And I'm Dr. Paul Nassif.
Hi, Doctor. How you doing?
Good. How you been? What's going on?
I'm doing good. I'm in the middle of a move, which is kind of crazy.
Wait a minute.
Chaotic.
Where are you in the middle of a move to?
I'm moving to Nevada.
You're moving out of the state of California. Is this now more for the whole tax thing?
It's everything. There's family there. It's everything. It's a whole culmination of things. And found a beautiful home in Henderson. And it's a little chaotic because, as you know, moving can be stressful to begin with, just even in state. But out of state is like a whole other level. And a kid that's getting his driver's license.
I get it. I mean, listen, I got in Vegas, I have a lot of friends out there. They don't live. I don't know if anyone lives in Henderson, but you're not far. And,
no, 20 minutes from the strip.
They all live up in Summerlin, most of these folks. And so it's except for the weather, which can be, challenging. Because you're used to the good old California weather.
Exactly. And I'm hearing the rumors of the August heat. And right now I think they're having lightning storms. And it's funny you say Summerlin.
Yeah.
I looked at Summerlin, but their school system wasn't good. So that's why I went with Henderson. Their Henderson school system is much better. So that's why.
Well, fantastic.
Yeah.
Well, that's good.
Yeah, I'm still going to come back and see you, though. You're stuck with me.
Well, I go out there a decent amount because we have some businesses and stuff. So, but they're on the strip. They're food places.
I'm literally 20 minutes from the strip. And everybody tells me that if somebody's flying in, they just text me when they land, and that's when I leave the house to go get them. Like, I'm that close to the airport, the strip, everything.
Well, no, Henderson, you're pretty close. I mean, there's a restaurant called Michoacan, which is in a place called Centennial Hills. So that's still on the other side of the strip. So from where you are, it's on the other side. And we bought a Mexican restaurant out there.
Oh, my gosh.
We have some bunch of stuff, but that's one of them.
That's so cool. I'll have to check that out.
Great Mexican food. But anyway, so we're going to have some interesting topic today.
Yeah, I'm actually really interested in this one because it's not one that I'm very familiar with. So there's certain things that I know, but I really want to hear what you have to say as a doctor and, the direction of hair loss. This is all about hair loss. And I have a feeling we're going to get a lot of men interested in this particular episode.
Yeah.
But I let's just jump right into it of, what is male pattern baldness? Now, I know females have it as well. It's not just a male thing.
Correct.
But I would love to hear from you.
I'll tell you one thing. When I first started my training and I was doing my fellowship in facial plastic surgery, God, that was back in 1998, 99. I used to start that point. I was watching hair transplant surgery that many years ago and watching the evolution. And, when I've learned about it, and we all know, there's this male androgenic, alopecia. Mm-hmm. And usually when you look, you'll see, the hair, it starts to get thin up, sometimes right the here. Temporal, but it's more here. Uh-huh. And sometimes they'll still have their hair in the temple, and they'll get the center part of the frontal bone going back to the occiput.
Yeah.
And I got to tell you, that can start you can start getting thinning hair in your teens.
Ow.
And again, you want to look at more of the maternal father, maternal grandfather.
Is that true? So that is true to look at the maternal side.
I mean, you look at both, but that's usually more.
Oh, interesting.
And the thing is, I've had so many of my friends, whether they have a good amount of hair or thinning or loss, but what's happening now. Men nowadays, just shaving it all off, and they're rocking that look of being pretty much bald. I mean, so they like that look.
Yeah.
However, once you start doing it, the thing is, here's a mistake that people make. And we'll get into, you know, really the different treatments for it. But one thing I want to mention just right out, so I don't want to forget this point. One of the mistakes that I saw a lot, and it looks so weird because, depending again on the different types of it's DHT, dihydrotestosterone. I mean, there's different types of actually when we talk about male pattern baldness. I don't want to get into the whole issue again about the actual chemical sensitivity of the hair bulbs and everything else like that. But again, it's a certain part of the testosterone that the way it's actually processed, it actually causes some of the receptors of the hair cells. It just doesn't grow and you start losing it.
Interesting. So it's more of a testosterone thing?
Well, it's not based on regular testosterone, no. And again, this is possibly, but again, it's a conversion. There's so many different theories about it. One cause of male pattern baldness is genetic, which is the most important thing.
Given.
Family history. But research has shown that male pattern baldness is associated with male sex hormones called androgens. And that includes regulating hair growth. So I'll give you the name here, Now, and that's what the whole growth cycle, there's a whole different types of different phases of growth cycles. But I want to see if they talk about it. And there's thyroid condition, cancers, medication, steroids, nutritional disorders, health conditions. Here, let's see. Genetics we just talked about, maternal side, the M shape they call it when you start losing it.
Interesting.
But I'm looking at them. So we'll go to the different ways they talk about this. But the interesting thing is I'm looking at everything. When we talk about this, it's called androgenetic alopecia. And again, but the andro, again, it has to do again with the hormones. And they haven't been able to treat the hormonal aspect to prevent it or change it really to stop having it happen. Even though there's the medications, the propecia and the finasteride, there's some different blockers and androgen blockers they're called. But what was happening, a lot of these young patients were going around here. And of course, everyone goes to Turkey. Everyone's known Turkey as a place because it's so inexpensive and you get a nice job. But when they were really young, what was happening is young kids, maybe in their late teens, 20s, were getting hair transplants around here. And once you take hair from the back, which it's not androgen sensitive for hormones, and then you put it here, you don't lose it. So it's not sensitive.
Interesting.
That hair in the back doesn't fall out here once you put it in. So the weird thing about this is these kids were coming in getting hair transplants in the front, and then guess what happens as they get older? 20s, 30s, 40s. As you know, the hair goes, they lose the hair more going back. So what was happening is they were bald, except they had these patches of hair transplants here and nothing up here. And you're going, oh my God, what happened to the poor guy? Then either you have to immediately have another one or you have to get some, get some laser hair removal.
Oh my gosh.
So they looked goofy. They looked horrible.
Yeah, that would look ridiculous. Now, I know, and we're going to get into the surgical side because I want to know all about that. But I first got to ask you, what are your feelings of things like Nioxin, Rogaine, the shampoos? Do they work?
I mean, to me, that there's different ways we treat it different over here in the office. But minoxidil or Rogaine, whoops, sorry about that. These are things that, I think that some of the minoxidil and Rogaine, the topicals, it can slow down some of the growth or the loss of hair.
The loss, okay.
I have had patients that come in and to see results. It takes 4 months, sometimes up to a year. But again, you have to be careful. There's some negative side effects of that. But minoxidil can work, the Rogaine, and there's shampoo, I think, and there's the topicals. And then, the medication is, Propecia. And I think if you're a female, it does slow some hair loss in men, but you can't take it if you're a female, obviously.
Right.
And apparently, so finasteride, Propecia, Proscar, it's better than the Rogaine, but it's a pill. So you have the topical, which is easier, then the pill, and then you can actually take it for about 3 months, and then you see some results. And then if that doesn't happen again, they basically say one of the reasons why you can't take it if you're a woman, because in a rare situation it can cause breast cancer.
Oh my gosh.
So, so we use there's something called, what the PSA is? Prostate specific antigen for a male. Mm-hmm. So now here's the interesting thing. If you're trying to watch your PSA as you get older, male, we follow our PSAs to see how our prostate's doing besides exams.
Correct.
Sometimes taking Proscar can artificially lower your PSA.
Oh, wow.
So that means you just got to be a little extra careful with your exams.
Oh, interesting.
So
that's good for me.
So my friend of mine, still takes it, finasteride. But I would think the simplest thing you can do is take Rogaine for that. But the thing is, what we've been doing a long time, is we've been injecting PRP in the office. Every one of my friends, women and men, platelet-rich plasma.
Yeah.
Because you remember, you have the inflammatory and anti-inflammatory factors in platelet-rich plasma. So the platelets are the ones that have all the growth factors that get released.
And that's when you draw blood, you pull out what is called the gold of the blood, correct?
Yes.
Okay.
Not the platelet poor plasma, which is more of the red.
Right.
The yellow, which doesn't have red blood cells, called platelet-rich plasma. And we inject that in the scalp. And Laura's been doing this, I've probably been doing it here for about 12 years, my office.
Really?
Yeah. And this is one thing that's probably we have befores and afters of our different doctors here and Laura injecting these patients. And there's been significant hair growth. Now, I can't guarantee it.
Right.
But platelet-rich plasma it's pretty benign. There's really no risks to it.
Now, when because it's your own body, but when you're injecting something like the PRP, how long does it take before you see hair growth?
Well, I will tell you what I've seen with that. I'm going to say 3 months.
Wow.
As the averages start seeing hair growth. It might be quicker, and everyone's going to, every individual may change, but this is something. They were also doing microneedling at the same time as PRP. And I think we do that also.
Interesting. Now, do you find that the older a patient is, the longer it might take before they see hair growth?
I don't think there's been any research on that yet.
Okay.
It doesn't. I don't think so. But that's something, once, we're going to get Laura on at some point.
Yeah.
Talk about the benefits of PRP, but because we inject it in the skin too for texture changes.
Right.
And, but this is something that I found everyone I know so far has said that PRP has made their hair thicken or grow.
Wow.
But again, it's not a guarantee. So I can't, when a patient comes
Yeah.
and you guarantee, because it's costing me $500 that it's going to work. I go, no, we can't. But anecdotal, says my patients are very happy with it.
But within 3 months, so how much hair growth does a patient see within that 3 months?
I got to tell you, it's really individual.
Everybody's different.
I can't say that.
Yeah.
But the point is, if you don't mind getting a little small baby needle in your head, or maybe getting some numbing cream on, maybe taking a little pain pill or something.
Yeah.
That to me is a no-brainer.
Yeah.
because it's your own. You're not on a prescription, taking a
Right.
pill which has some side effects. And the shampoo, you can still use it once you grow the hair.
Mhm.
I don't think, the long-term side effects, are very small for using Rogaine or, the minoxidil. But obviously, I want everyone to always look at the risks with taking any medication or
Correct.
topical.
And side effects. Now, I have to ask you even simple little things because I got to plug you here because it's good stuff. The biotin and the collagen gummies that you may, which by the way, I wish I could just eat the whole bottle in
Oh,
one
they have
sitting
this sort of the
because they're
candy.
so good. They're so like it irritates me that I can only have two of each. That's what the directions say because I want the whole bottle. They're just so delicious. But how do you feel about biotin, collagen, things like that?
Yeah, because the hair, scalp, and nails, basically, it's biotin
Mhm.
and vitamin B3 and the collagen. Those actually do help in more regards to keeping your hair thick
Mhm. And
and health
skin.
of the hair.
Mhm.
I don't think it's going to grow
Got
new
it.
hair.
Got it. Got it.
And by the way, there's another term called telogen effluvium. That's called traumatic hair loss. So let's say I'm doing a brow
Mhm.
lift, or you had some procedure and you traumatized the hair, or doing a facelift, and if you're into the hair at all, you can lose, because it's a shock hair loss,
Yeah.
up to 3 to 6 months. You can lose hair because there's a quiescent phase, a growth phase, different phases of the hair.
Right.
And so you can lose hair in that area because it's more of a shock hair loss. Your hair falls off and then it grows back after a certain amount of time. 3 months, 6 months, 9 months, even up to a year.
Wow.
Sometimes you can cause a shock hair loss which is permanent. It's rare, but it can happen.
Wow. Now I will say, I mean, after our work together,
Yeah.
I feel very lucky, and it's also your hands, but
Hair.
I didn't have any law. I still have my little bump, but that's not a hair thing.
Yeah, that's
The
the
bumps
little
are still there.
implant.
Yeah, I mean that's why I have my bangs, but you can see, the little bump is still
Yeah,
there.
you're still there.
Yeah, it's still there,
But
but the hair loss,
how did your incisions heal for your
oh,
brow lift?
like there was nothing. I mean, really, once you took the staples out, I mean, yeah, there was a little patch, but I would say within a month, all the hair was back. It grew so quickly and so well. But you know me, I'm very big on my vitamins. Again, I don't know if that's part of it, but I am big on my vitamins. I'm big on eating healthy foods. I eat all my vegetables and my fruits, even though I don't like fruits. But I do take good care of myself, so I feel maybe that helped. But I mean, also your work was so great that I was really surprised that, I mean, that was a pretty darn big incision I had along the side of my face and right in the hairline and zero hair loss. The only thing I did notice, now this is a funny thing, and tell me what might maybe would have done this or not done this. After surgery, I noticed now again, touch wood, I've never had gray hair, but I did notice a little streak of gray in the back of my hair, which sounds like maybe a trauma thing. I don't know. What would that be?
It's nothing related to your surgery. I don't
I
know
didn't
what
think so. But it's like,
the.
I felt like the mother from Poltergeist, how she got the streak of gray.
Oh my God, how funny.
So
Yeah,
I just
that's
like
something. Yeah,
little
that's
streak
freaking
in the
great.
back. That's like
Usually that
Poltergeist.
happens in the front, though. I don't know what that is, why you had gray hair in the
I
back.
know. And it's a one strip. It's so funny. I like it.
Well,
I dig it.
so let me ask you a question now about. I heard this, and I think I've seen this before, but I want to get your opinion. So, when you are someone who chronically uses extensions
Mhm.
and you're attaching those extensions to your existing hair,
Mhm.
does it sometimes pull off the hair and it doesn't grow back at all? Have you heard of any of this,
Absolutely.
especially
Yes.
with what you do?
Absolutely. I'm very well versed in extensions. I don't know if it's in the blood because of my family starting in hair in the 1800s. I mean, they were the wig
Very.
makers to the royal court.
That's right.
My
Yeah.
great grandfather was Winston Churchill's barber. So I
Yeah.
don't know if it's in the blood that I do have a love and passion of, wigs, extensions, hair products. But I know everything there is to know about extensions. Now, beads, wefts, anything that does kind of get in tight and wrap around smaller sections of hair, I've always seen people with hair loss. The only one that seems to do the least amount of damage, and even then you want to take breaks, the least amount are the tape-in sandwich, and they're about this thick, and they're two pieces of surgical tape, and they sandwich your hair, one on either side. And they're not as versatile. You can't have as many hairstyles. You can't pull a high ponytail or anything like that. However, the breakage and the damage is almost nominal with that kind of hair extension. You can still see a little bit if you're somebody that maybe picks at your hair or you let them grow too long. There are a lot of women that will go 3, 4, 5 months, which I couldn't even imagine when I have my extensions in. I can't even go past 5 weeks because I get so annoyed with the growth. So it's all about the care that you do, how you take care of them. But hair extensions, they can be damaging. Yeah, they will cause and can cause some baldness.
Interesting. So that was a good commentary on that, because I thought so.
Yeah.
I thought it was more the damage, So when it comes to hair care, they're doing eyebrow
Yeah.
all the time. I think, maybe I'm wrong, I heard somewhere about eyelash, not eyelash extensions, but I heard someone was trying to do eyelash transplants.
Wow. I've not heard that.
I don't know if it could be done. I don't know if it was more of just me hearing some BS and it's not real. I don't know. I haven't researched it. But as you know, when it comes to hair transplants, and there's candidates for it, men and women, mostly men, obviously. And, they get, there's the different ways to do it. I mean, there's so many different robots now that do it. There's actually, there's robots that actually will make the little insertion hole, then they'll place it into that hole.
Jeez.
We have, there's so many different types of machine. We have Neograph, for example. And again, it's a way to extract, and then you're making your hairline by putting all these little holes in here, and you're extracting on the back of your hair one by one versus the strip.
Right.
You're taking that strip out, and you're cutting them into singular, follicular units, or FUEs. There's different, I don't personally do them. Dr. John Frederick in my office, he's been doing them for years. He even had he's probably going to kill me, a little hair transplant.
He's spilling the tea here, Dr.
So he had a hair transplant not too long ago, but he does all of them. And so when someone says, well, do you go to a place like Bosley? I know plenty of people that go to Bosley. Have good results, great results. It really depends on who's doing it and the techs. It's really your techs. For example, a great tech has been doing this for years, and we use a couple. They've been doing it for maybe over 25 years. They know where to make the hairline, how low, how high, what shape. Right. They know how to make the little insertion points. They know how to do everything. And the doctor kind of comes in, helps, maybe makes the hairline, does things like that. But they're preparing all the follicular units, the little hair grafts, whether it holds 1 unit versus 2 or 3, of hair follicles in one little unit.
Right.
So that's something that when I talk about, you need a good tech or two that can do it with you all the time. And some of these places have that.
Right.
There's all over California, everywhere, there's good doctors that do this, good offices. And it's usually because of the tech, most of the time.
Now, I remember from your office, Dr. Pang, didn't she do hair restoration?
Yes, she did. Or she does.
She does, yeah.
Yeah. So she's in her own office now. So in my office, because I had the machine, it's Dr. Frederick.
Got it. Okay. I wasn't sure if she was still there or not. Interesting. Okay. So I got to ask you a question. I feel like I can ask you because you've got a good head of hair. So why do you think it is? Because as a woman looking at a man, like, it's not something that really crosses my mind to go, oh my God, he's balding. I don't think that. Why do you think men get so sensitive, feel so, I guess there's a sense of shame when they lose hair?
I think in the beginning they may, but then as they get used to it and it starts getting more significant, a lot
Mhm.
of men that I know that are younger are going to seek treatment immediately,
Ah,
you know. And then again, there's these um, websites and TV commercials. You can get your Viagra, you can get your finasteride, you can get all that online now.
yeah, yeah.
They maybe talk to some health professional. So there's all these different sites that you can get this stuff.
Mhm.
But a lot of the young men are going to do that rather than going to a doctor's office and say, hey, what is the best course of treatment?
Right.
Okay, I'm 21 right now. Here's what I'm going to do. Here's what you're going to do for the next 4 years. Do this. And then after that, you're going to do this. You're going to prep for your hair and then you're going to do the transplant. So all these things, can happen,
Mhm.
in regards to what you want to do. Again, there's always ways, but the biggest thing is you just want to take care of yourself. And if you know you're going to start losing hair, the shame, again, the men that I know now, they take it all off. They shave every week
The shame, yeah.
and they like that look. They've gotten used to it. So I think some of the shame of being bald is kind of decreasing.
Yeah, because there is no
I
shame.
hope
I mean,
so, because
yeah,
it's not really, and they might be embarrassed. I'm got thinning hair, but girls don't care about that anymore. Or
no, we
no one
don't
cares.
care, and I feel like there's some men that have this, like, Samson complex, but, as a woman, like, I don't care if a guy is bald, if he's balding, full-headed, like, it doesn't matter. It's hair. It's a nice thing, but I don't know. There just as a woman's point of view, there are other things about a man that are far more attractive as far as personality, laughter, intelligence, eyes. That's just my point of view.
Love that. So I agree. So that's why I think it's maybe not as, it's just like it was shameful and embarrassing to get Botox a long time ago.
Yeah,
You hit
you're
it for
right.
number one. So this is the same thing. But the good news is there's treatments. I'm lucky. I have a good amount of hair.
You got an amazing head of hair.
So I got lucky. The only problem is it's turning gray quicker all of a sudden the last 2, 3 months. My wife said I have a lot more gray hair. I don't color my hair, by the way.
Don't.
I do
Please
not.
don't. Okay,
No.
because I personally, again, personally, just my opinion, I think the salt and pepper is very handsome.
When I grow my beard, which I'll probably get after I stop filming, that's really gray.
Really?
Oh, yeah.
Like
Well,
full
you've
gray
seen
or
photos.
salt and pepper?
No, salt and pepper.
Yeah, salt and pepper's cool.
So did I give a good general overview, simplistic as possible
Yeah, you did. I think
regarding?
the only 2 questions that I have are how difficult and long is the PRP process as opposed to, like, what you were saying Dr. Frederick does? I mean, is Dr. Frederick's procedure, is it long and painful? Are you put under for it?
You just do it in the back. She'll draw the blood, spin it, get the platelets, inject it right there.
Well, no, I'm talking about
Dr.
Dr.
Fred,
Frederick's.
well,
Dr.
Dr.
Frederick's.
Frederick, no, it's in the office too. Hair transplants and under,
Wow.
they get numbing in the back. They have lunch. They do everything.
Huh.
You know,
And it's like within a day, you got hair coming back in again.
yeah.
Interesting.
So anyway, that's it. Yeah, I just texted Laura.
She's somewhere in the office.
So she's back there somewhere, but I just was going to ask her. Do you do it every 6 weeks, 8 weeks, 3 months? I was going to ask her when she comes in.
But if you want more of an immediate result, you would do something like what you're saying Dr. Frederick does.
Now, once you get the new hair transplant in, that falls off too. It goes into a resting phase. So that hair falls out that you transplant temporarily.
Because I do find this very interesting, that approach of the PRP. I know it's not instantaneous. And I feel like a lot of men, if they're going to do a process, they're going to want instant results. But you're obviously seeing both. Am I wrong on that?
Nothing is instant.
Mm, okay.
The point is though, but what about these wigs and all that kind of stuff and these hair
Yeah.
pieces? Do
Yeah.
they look How do they look?
It depends. It depends on how much you're willing to spend. If you're going cheap, they're not going to look very good because they're synthetic. But there are gorgeous real hair wigs and clip-ins and extensions. Now, when you go the real hair route, you're going to spend more. It depends on how much you want to spend. Like anything in life, the more you spend, the better quality you're going to get.
Well, there you go. So that's it. I mean, it's the wigs. Laura, by the way, is going to walk in here in a minute.
Awesome.
Because to me, the PRP is the simplest way to go because it's not a procedure, surgical operation like a hair transplant.
Yeah.
Again, it's an injection in your scalp. At some point in the future, they might start injecting stem cells or something.
Yeah.
When that ever becomes legal, but you can't really do that.
Yeah.
I mean, other than that, listen, I think we spent a good amount of time talking about this. I think we have a lot of information. Here, Laura, come in real quick. Come over my shoulder and just say hi. McKenzie.
Hi, McKenzie.
Of course, she says hi.
How are you?
So when you're doing PRP, first of all, to see some results, number one, how long does it take usually? Men and women, ages, and what's the frequency?
I would do 3 to 6 sessions. You treat once monthly, and then you want to stop afterwards for 3 to 6 additional months. Obviously, hair does not grow overnight. You just want to give it some time. I usually do recommend an oral hair supplement at the same time.
The biotin, the oral hair supplement, or what?
Carry Vitastel Pro.
Vitastel Pro. We have it,
right? We have your lovely biotin gummies.
And we have my biotin gummies, the biotin gummies, all that.
Yeah. Good.
So, and how long does it take to start seeing some growth?
I would give it 3 months after your last session. So it does take quite a long time.
It does take a long time?
First thing, it's kind of like watching paint dry. So I would just do a full 3 to 6, give it 3 to 6 months after that to reevaluate and then go from there.
So you have to be committed to it.
Correct. There could be hormonal causes or stress causes.
Stress, hormonal, everything. Friction. Men and women?
Interesting. Thank you, Laura.
Thank you, Laura. So I think that was pretty good. This was a good little podcast talking about hair, a little oomph.
Yeah, this is fantastic. And I'd actually be honest with you, very educational for me because like I said, this isn't a world that I know very well. So you definitely taught me a couple of things, but you always do.
This was a fun one.
This was great. This was really good.
I think I need to get some PRP here myself.
Oh, stop it. Do not. If I could reach through the computer and just slap you, I would.
How funny.
You don't need it. You're fine. No, I think this was really, really educational. This was really great to hear because there are obviously options for those that are not liking their male or female pattern baldness. There are obviously some fantastic options. I did not know anything about the PRP, so that was really awesome to learn about. And I have a family member that might be calling you.
Woo! We're here. Well, listen, it was great seeing everyone once again with Demystify Beauty. And from our standpoint, again, I love everyone seeing what's happening new in my life at drpaulnassif.com. Plus, I think we're going to put down, I have so many other different handles from my skincare by Dr. Nassif.
Yeah.
And then you have your one main one, which is what again?
Yeah, everything for me from Instagram to TikTok to Facebook is all at M Westmore. And then my Twitter is my full name, but no E at the end.
Well, the good news is one thing too. I will tell everyone that if you have to have one advice for everything, and it's so hard to do, but if we can cut out stress or decrease it, that helps prevent loss of hair plus your whole life.
Right. So much easier said than done, but you're right, Dr. Nassif.
Well, thank you all. We'll see you next week.
Thank you so much. Thank you for listening to Demystify Beauty, produced by Gotham Production Studios. If you have any questions for future episodes, please don't hesitate to reach out to us on Instagram at Demystify Beauty or email us at demystifybeauty@gmail.com. And don't forget to subscribe, rate, and review the show. See you next time.